Welcome to Health Facts with Normanie Ricks. I am your host, Normanie Ricks. Today's guest is Dr. John Lipman. He is the founder of the Atlanta Fibroid Center. He's actually going to give us the health fact of the day today. How are you doing, Dr. Lipman?
I'm great. Thanks for having me.
Welcome. Go ahead.
The fact of the day is hysterectomy is the second most common surgery that's done in the United States. And that's kind of surprising because half the population are men and men don't have a uterus. And the most common reason why we do hysterectomy in this country is not cancer of the uterus, which would be appropriate. It's for these benign fibroid tumors, which are really common in women, particularly common in African-American women. It's estimated that 80% of Black women have these benign tumors.
Why do so many Black women have fibroid tumors?
Well, there are a number of reasons, one of which is that it runs stronger in African-American families. African-American women get fibroids earlier in life. They get them bigger, more numerous, and they tend to become more symptomatic the bigger and more numerous they are. So they're also more likely to get hysterectomy. We don't know where fibroids come from, unfortunately. There hasn't been enough research done on fibroids. But once they arrive on the scene, they grow with hormones, particularly estrogen. Okay. And estrogen is produced and stored in body fat. And so one reason that African-American women disproportionately suffer beyond the genetic reason is that they tend to have more body fat than other racial groups. And if you look at body fat distribution by race and fibroid incidence by race, they're identical. African-American at the top, then Latino, Caucasian, and Asian women at the bottom, lowest body fats and lowest incidence of uterine fibroids. Now, that's not the entire equation. There are other things. Back in the day, hair relaxers were very commonly used. And if you look at the main ingredient in hair relaxers, it's biochemically very similar to estrogen. Not as big of a problem these days because more women are wearing their hair natural. Vitamin D plays a role here. Okay. Vitamin D, only 10% of African-American men or women have adequate vitamin D. Vitamin D is a very powerful anti-fibroid growth hormone. It's really technically a hormone, not a vitamin, but because there's such a low incidence, and it's also a very powerful fibroid growth inhibitor, that's another reason why African-American women disproportionately suffer with fibroids. Is
this vitamin D3? Like, can we get this over the counter?
Yes, it is vitamin D3, and it's important to get your vitamin D checked because it's a simple thing. I mean, when people see us at the Atlanta Fibroid Center and they're suffering with fibroids, we try to get them help with exercise and optimal weight. Some women have very low body fat and they're in great shape. We don't have to talk to them about exercise and nutrition. They're already doing the right things. But even those women sometimes are very deficient in vitamin D, and we try to have them get their vitamin D levels checked because that's a very simple thing to supplement, either taking over the counter or sometimes because they're so low, they need a much bigger prescription boost of vitamin D. But it's important to get it checked because unlike vitamin C, which is a water-soluble vitamin, you take too much vitamin C, you'll just pee out what your body doesn't need. But vitamin D, you can get too much, and so you need to have the levels checked appropriately.
Now, can you get this administered through IV, or is it a pill, or is it
most women can take oral supplements of it and be okay. And so there are estrogenic foods, foods that are kind of have hormones in them. I mean, it's impossible to avoid hormones in the food supply. It's even in the water. But if you can moderate or eliminate red meat, non-organic chicken, and dairy, that's another factor because those are hormone-rich foods. And if you can increase your amount of colored fruits and vegetables, which have flavonoids in them, they block an important enzyme in estrogen production. again, these are things, you can't pick your parents, you can't do anything about the genetics, but if you can do these nutritional things, exercise, try to be as close to your ideal body weight and have adequate vitamin D, you're doing a lot of good things to try to keep those fibroids at bay.
Okay, that's awesome. So, Dr. Lipman, I read that you went to Georgetown, Yale, and Harvard. So, can you tell us a bit about your journey and how you got interested in what you do?
Yeah, I went to Georgetown Medical School, and then, as you mentioned, did my residency training at Harvard, and did a fellowship in interventional radiology. That's the specialty of radiology that I'm involved in. And that was done at Yale. And then I came to Atlanta 31 years ago. And more recently, I struck out on my own and started my own practice, and had the Atlanta Fibroid Center, which is a state-of-the-art medical center dedicated to treating women suffering with fibroids. And we've seen women from all over the globe. With COVID, our international patients are no longer being able to be treated, but we've seen women from all over coming to the Atlanta Fibroid Center because they want non-surgical options. You mentioned, and we talked about hysterectomy being such a common procedure, and it's really unnecessary for fibroids. I'd say the most important thing that I would say during this podcast is that no matter what your physician tells you, you do not need hysterectomy for fibroids, no matter what they say. Hysterectomy should be the option of absolute last resort,
right,
not first and only option, which is typically what's done today. And patients need to know about uterine fibroid embolization, UFE. It's one of the biggest medical breakthroughs for women. That's a procedure that we perform at the Atlanta Fibroid Center. It's completely outpatient and non-surgical, so no hospital, no general anesthesia, no surgery whatsoever. Our patients go home the same day with a Band-Aid. That's it. A Band-Aid. And they go home with their uterus. They go home with their uterus too.
That's the most important thing.
And we've had numerous children born after UFE. Wow. I've had multiple sets of twins. So you can have children. It's covered by all insurances. And we take everything, including Medicare and Medicaid. And so this is not an insurance issue. It's covered by insurance. It has a long track record of safety and efficacy. It works in our hands a little bit over 90% of the time. So patients get the relief of these horrible symptoms, and we can talk about that. They get to avoid the risks and long recovery of surgery. And importantly, and often underappreciated, they get to keep their uterus, because I can't tell you how many times I've heard from patients, well, my doctor told me if I'm done having children, I don't need my uterus anymore. And that's ridiculous. Right. The uterus is not a disposable organ. It has consequences. It's important no matter what your age, no matter what your desire and fertility is, your uterus is important. There are so many things that happen to women after hysterectomy that they don't know about. You know, I'm not talking about the obvious risks of surgery, whether it's intraoperative bleeding requiring transfusion or injury to adjacent organs, bladder, ureter, bowel. I'm talking about what happens to a woman when she loses her uterus. It's the epicenter of what makes you a woman.
Right.
And there are women that struggle psychologically. There are a lot of women that struggle sexually. Loss of libido, loss of orgasm. You can't remove a sex organ without altering your femininity and your sexual function. It's impossible. There's a lot of urinary leaking. You take this big fibroid-filled uterus out of the woman's pelvis, and now she leaks urine. And in fact, I will say, if you go to any large grocery store, like in this area, we have Kroger, Publix, or pharmacies like Walgreens or Rite Aid, and you go to the section where they sell adult diapers. Mm-hmm. If you go there, you expect to see, at least I expect to see, an elderly man or woman on the packaging. You won't see that. Who will you see on the front of that package? A young, attractive African-American woman. Why? because that is their target audience, not grandma and grandpa. It's the average age of hysterectomy is less than 40. And I have seen way too many women in my travels for the past 25 years or so treating fibroids, way too many women under 30 that have already had a hysterectomy. None of them wanted it, but that's all they were being offered. And so they succumb to these horrible symptoms and they say, you know, okay, you win, here's my uterus. And
let's talk about some of those symptoms. Let's talk about some of the symptoms.
Well, there's the big three. There's a lot of symptoms that you can get with fibroids, but the big three are heavy menstrual periods, heavy bleeding, it's the number one reason why women have heavy periods. Second, pelvic pain and pressure. And third, increased urinary frequency and waking up at night to urinate. Okay. These fibroids are hard and firm. They're like rocks, and they press on whatever's next to them. So if they happen to be toward the front of the uterus, the bladder sits there and it's right on top of the bladder and it acts like a paperweight and crushes the bladder. So the bladder doesn't fill to its capacity. So a woman has to urinate more frequently and get up at night to urinate. If it's more central in the uterus, near the uterine cavity, it stretches the lining and causes these horrifically heavy crime scene-like periods. If it's more lateral, it'll press on pelvic nerves to cause pain throughout the pelvis, back, buttock, down the legs. Mm-hmm. It can cause painful intercourse if they're near the cervix. It can cause constipation. Patients often aren't aware of they don't associate constipation with fibroids, but if these fibroids are in the back of the uterus, guess what sits right behind the uterus? The colon.
Right. So let me ask you this. How many patients do you see a week and how many surgeries do you do a week?
Well, I don't do any surgeries. I'm not a surgeon. I save women from having to undergo surgery.
So let's talk about the actual procedure. What does it entail?
The procedure, again, is called uterine fibroid embolization. Some people call it uterine artery embolization, UFE or UAE. Same procedure. It is basically a procedure where we enter the body usually at one of 2 points, either at the top of the right leg, which is most common, or in the left wrist. And we use those arteries as highways to get to the uterine artery. And I can place a little tiny catheter, like size of a piece of spaghetti, into the uterine artery one at a time. Women have 2 uterine arteries, one on each side. And each of those uterine arteries branch like a tree, getting smaller and smaller branches till you get out to the leaves. The fibroids are the leaves of the tree, and I know what size those small peripheral branches are, and I can plug them up with these little tiny particles. The particles are made out of what are called PVA, polyvinyl alcohol. It's the material contact lenses are made out of, and they're ground into particles of certain sizes, perfectly sized for these small peripheral branches of a fibroid. And so I plug up the fibroid's blood supply, and without a blood supply, the fibroids will die. As they die, they will soften and shrink. And as that occurs, a woman's symptoms go away. So
how do they pass after they die?
Well, they just kind of shrivel up, like going from a grape to a raisin. Just like a woman who goes into menopause. A woman in menopause, the fibroids just die off naturally, and they kind of involute and shrivel up in the muscle right where they are. And so women often have fibroids their whole life. We call them passenger fibroids. Okay. And they die with them. When they die, they just kind of shrivel up and they're just in the muscle. They're there, but they don't cause symptoms anymore. So for most women, once they get to menopause, fibroids aren't an issue anymore. We do treat some women that are postmenopausal, but this primarily is a premenopausal problem.
Okay. So I know that I got diagnosed with having fibroids when I was pregnant with my daughter. I never knew that I had any fibroids, but it was very painful when I was pregnant with her because I guess she was kicking the fibroid. So I was told. So, and then after I had her, the fibroid shrunk back down. And now that I'm getting older in age, it's growing again. So it seems like a never-ending cycle. So how do women talk to their gynecologist? How do they ask about, how do they know if they have fibroids? Just kind of go into that.
Well, as you mentioned, sometimes people find out about fibroids through, they feel these things. If they're in the front of the uterus, they might be able to feel them through the skin because they're hard and firm like rocks, as I mentioned, and the woman is kind of soft and squishy. So she kind of can feel this difference, this hardness. Sometimes it's detected based on symptoms. Women have really heavy periods and pelvic pain. They go to their doctor with these symptoms. The doctor will do an examination and can feel these fibroids, whether on the outside or internally, vaginally feel them. They'll often feel these fibroids and go, I think you got fibroids. You have the symptoms that go with this. I can feel these things, or at least some of them. Let's confirm the diagnosis with an ultrasound. So they will get an ultrasound, and ultrasound will confirm whether a woman has fibroids or not. Sometimes they have symptoms of fibroids, and they might have a condition called adenomyosis, which involves the uterus. Essentially, it's endometriosis of the uterus. That's in simple terms. And we also treat that with embolization. So it's important to confirm the diagnosis and then suggest appropriate treatment options once they've made the diagnosis.
So what exactly is endometriosis?
Endometriosis is when the lining cells of the uterus, that's what bleed each month, when those cells are found outside of the uterus. They can be anywhere outside the uterus, but most commonly in the pelvis somewhere near the ovaries, fallopian tubes, or in the pelvis as deposits. And they bleed each month. They act just like they would if they were on the lining of the uterus where they're supposed to be, but they're like out in the breeze. And so adenomyosis, this other condition that I mentioned, is when those lining cells plunge deeper into the muscle of the uterus. So by definition, even though it's the same process, because it's in the uterus itself and not outside, it can't be called endometriosis. So they gave it its own name, adenomyosis.
Interesting. So how did you learn how to do this procedure?
Well, I've been embolizing tumors we've been doing fibroids at the Atlanta Fibroid Center for the past 25 years. And we've been embolizing tumors, usually cancerous tumors, even longer than that. I've been practicing a little over 30 years now. So we were originally embolizing cancerous tumors to make it an easier operation. In fact, that's how UFE was discovered, because there was a long history of embolizing cancerous tumors to try to cut the blood supply off to cancerous tumors to make it easier for the surgeon to remove and a shorter operation for the patient. And someone in France in the early to mid 90s got the bright idea to embolize fibroids prior to hysterectomy. But the difference being in France, where they started doing this, there's socialized medicine. And so the healthcare is rationed. So you have to wait for your elective surgery, unlike this country where we embolize somebody, say for a cancerous tumor, they're in the operating room an hour later, 2 hours later, same day, or at most the next day. Whereas in France, they had to wait 6, 7, 8 weeks. So they were embolized, discharged, and they would go home waiting at home for their elective hysterectomy. Well, what happened? Over that 6, 7, 8 weeks, their symptoms started to go away. So they called their doctor and said, do I need this hysterectomy? Because I feel great. My periods are normal. My pain's gone. I feel great. And so when they looked at it, the answer was no, you don't need the second part. You don't need hysterectomy at all. Wow. All you need is the embolization, and that'll take care of it. So I happened to listen to the first 11 patients that were done at UCLA. I was giving a talk on embolizing cancerous tumors, and Scott Goodwin from UCLA, the interventional radiologist, was giving his talk on the first 11 patients that were embolized for fibroids in this country, and the light bulb went off. I knew I lived in Atlanta, worked in Atlanta. This was a particularly common problem for the African-American woman, and this became my life's work. So I did the first one here in Georgia many years ago, and have now amassed the largest experience in the United States in this procedure.
That's amazing. Now, I know you've had a couple of celebrity clients that have spoken out on your behalf. So I guess we can bring those up. I know we can't talk about people that haven't come forward because of HIPAA laws,
Right.
but the ones
Exactly.
that have, can you kind of speak on those?
Well, yeah, we've had a number of celebrities. The ones I can speak about, as you mentioned, have told their story and gone public with it. One of the most notable ones is Cynthia Bailey from Real Housewives of Atlanta. She was very courageous. I mean, imagine someone in the beauty and fashion industry, model, with these horrible periods, an embarrassing kind of topic to talk about. In fact, the straw that broke the camel's back was when she was at a Bravo dinner, and she just, the typical period just let loose on her, and blood was literally pouring down her legs. She's in this beautiful gown that, obviously was ruined, and people were still coming up to her trying to get selfies while standing in a pool of her own blood. I mean,
oh my gosh.
it was that was the straw that broke the camel's back, and so she wanted to do something about it. Knew of our work and came in, and she said, I gave her life back. I gave her sexy back, because that's another thing that sex often goes out the window when women are suffering with fibroids, because for a couple of reasons. One, they're anemic. They're losing so much blood each month, they can't possibly replace it. So they become anemic. And anemia is this loss of iron and hemoglobin. They become chronically fatigued, tired. Sex is exercise, and it's all they can do just to get through the day. So that's one reason. And the other reason is when you're bleeding so heavily and you're wearing adult diapers to try to capture this blood, you don't feel very sexual.
Right.
So that's what happened with Cynthia, and she was very frank and open about it. Fortunately, brought a lot of attention to it. Peter, her husband at the time, thought she didn't love him because the relations had stopped, and it wasn't anything of the sort.
Mm-hmm.
She was struggling with fibroids, and once he understood that, and that's why we really like it when men come to our talks, so they can kind of empathize with what their woman's going through. No guy wants to talk about periods or learn about periods, but it really is something that they need to know more about and empathize with, because this is a huge problem for women, particularly women of color.
So when you were talking about, you learned about embolization when people were going through cancer treatment, that was interesting for me, because I was thinking the opposite. I was thinking, oh, that's when people get a hysterectomy when they have cancer, or that's when they need surgery, when they need to go in and take out the tumor. Like, I guess it seems a lot more frantic, but interesting that it's the opposite.
Yeah, I mean, you don't need to have such invasive stuff done for benign tumors like fibroids. So if you have uterine cancer or other cancers, taking that cancerous organ out is appropriate.
Mm-hmm.
But when you have benign tumors, you don't need to be so invasive and aggressive.
Right.
UFE gives the patient their life back. It works very well. Patients love it. They don't have to deal with a hospital. They don't have inpatient admission. They get the relief of symptoms. They avoid all the surgery, and they get to keep their uterus, which, again, as I mentioned earlier, there is every reason to keep your uterus no matter what your desire for fertility is. Your uterus is important to you. In fact, we have a hashtag, don't lose your you. And it's don't lose you are you. Don't lose your you, kind of an alliteration. Because when you lose your uterus, you often lose your YOU, what makes you a woman, your epicenter of your womanness, and it's unnecessary. There are a lot of risks associated with hysterectomy. Just don't need it.
That's very interesting. So if someone is looking for you and looking to get this procedure done, how do they find you?
Well, it's real easy to find people these days with all the social media stuff. Our website is atlii.com, atlii.com. We have a Instagram page, which is dr_, my last name, dr_LIPMAN. We have a YouTube channel with over 150 videos on fibroids, on the UFE procedure. That's Atlanta Fibroid Center, Atlanta Fibroid Center. And if they want to just pick up the phone and make an appointment or call us, that's easy. That's 770-953-2600, 770-953-2600.
And I thought it was great that you said this procedure is covered by all insurances.
Yes, all insurances cover it. There's a long track record of safety. And so that insurance should not be the barrier here, that and say we accept everything, including Medicare and Medicaid.
Okay. So in preparation for their appointment, you're saying that people need to exercise, eat more fruits and vegetables, take vitamin D, maybe drink more water. Any other suggestions?
Well, I think trying to be as close to your ideal body weight is really helpful. And when you're doing all the right things, it's not only good for your fibroid health, but it's also good for your cardiovascular health, your overall health. So these things that we try to have people do are helpful for their overall health, not just their fibroid health, which is great.
Well, I think that you are changing lives and making a huge difference. And thank you so much for being a guest today. And hopefully you can get a lot of people to come and not have those invasive surgeries.
Yeah, we're hoping to stop hysterectomies for fibroids. It's truly unnecessary. If a woman wants hysterectomy, that's fine. But the vast majority of women don't want surgery. They don't want hysterectomy. They're just not given any other option.
Right.
They've never been told about UFE, and every woman is entitled to know all the treatment options, not just the surgical ones. And unfortunately, that's been the case for a number of years now, but we're trying to end that and trying to empower women with information that they have choices. They don't need to undergo surgery, no matter what your doctor tells you. For fibroids, you do not need hysterectomy. That's the message.
Awesome. Awesome. Thank you so much.
Thanks for having me.